सवाल ये है कि फ़ैट डिज़ोल्विंग इंजेक्शंस या मोटापे को कम करने के लिए सबसे बेहतरीन तरीका कौन सा है। ये सवाल सारा दिन क्लिनिक में होता है। सो टू मेक इट ईजी आई हैव डिसाइडेड कि हम एक कंपैरिजन करते हैं। इफ़ द पेशेंट आस्क मी कि डॉक्टर साहब मैं ओजेम्पिक वर्सेस फ़ैट डिज़ोल्विंग इंजेक्शंस या फ़ैट मेल्टिंग इंजेक्शंस इनमें से किसको चूज़ करूं, तो आई विल गो फॉर fat melting injections. If there is a comparison between lemon bottle and fat dissolving injections, I will always choose fat dissolving injections, fat melting injections, which is deoxycholic acid. If the comparison is between Saxenda and the fat dissolving or fat burning or fat melting injections, I will always go for the fat dissolving injections, which is deoxycholic acid. If there is a comparison between Victoza versus fat melting, fat dissolving injections, what I will choose, I will always choose fat melting injections, which is deoxycholic acid. If the comparison is between a lipofreeze, fat freeze, or you can say the fat freezing machines, which are right now very in many clinics, and I will always choose in a comparison between fat freezing and the deoxycholic acid, I will go for the fat dissolving injections. And if the comparison is between the fat cavitation therapy और फैट वाइब्रेशन थेरेपी जो बहुत सारे क्लिनिक्स में एज अ थेरेपी सेशंस के तौर पे किया जा रहा है, तो व्हाट विल आई चूज़ बिटवीन दीज टू? I will always choose fat dissolving injections, fat melting injections, which is deoxycholic acid. If you ask me liposuction versus fat dissolving injections, I am always going to choose fat dissolving injections, which is I am using, and I have conducted my own study on a huge number of clients, and the pros and cons and all the things which I have concluded from the study, I will always go for the fat dissolving injections, looking at the problems associated with the surgery, anesthesia, infection, and post-operative care. If you ask me abdominoplasty versus fat dissolving injections or the fat melting injections, I will always go for the fat dissolving injections. If you ask me slimming drips or slimming drips cocktails, which are available like in many types, many versions, whatever are the versions, I will always go for the fat dissolving injections, fat melting injections, which is deoxycholic acid. If you ask me again, lemon bottle and fat dissolving injections, I am really biased towards the fat dissolving injection. उसकी reason क्या है कि I have personally used lemon bottle on myself. I have personally used lemon bottle on a group of patients which was like very closely supervised by me, and their move, their step count, their diet, their BMI, their medical history, the selection of clients was done by me. It was a model program, and I have found out that lemon bottle, as compared to the deoxycholic acid, has not given me long lasting results. It is not permanent. The fat inches, the inches of fat which we dissolve, they really come back, they rebounds back. The problem is not that you are unable to lose fat or people are unable to lose fat. People are much more smarter than doctors these days. They know all the nutrition, they know all the derivatives, they know the micros and macros and proteins and carbs and everything. And the main problem lies in the area where the fat is rebouncing back, where the fat doesn't stay. So what I have seen, what I have concluded, lemon bottle versus fat dissolving injection, that the results which I get with lemon bottle, they are not long lasting. Probably it is organic, or probably it is organic or too organic for people like us who have like very hard fat, and the product is very expensive, the derivative is very expensive, it's very hard, it's difficult to cope up by the client. It's the economic stress on the patient's pocket is so much that whenever we end up with lemon bottle, even if they spend so much money, after 4 to 6 months, all the fat rebounds back, all the inches come back, all the areas which we had reduced, they come back. So that was my summary of consensus, and now in my next series of videos, I'm going to explain you one by one that why I am biased and in which clients I am not biased towards fat dissolving injections. Obviously, I cannot say that I am 100% always going to choose fat dissolving injections in every scenario, but that was a comparison in a holistic approach, because usually when the client come, the selection of client depends on the history, medical criteria and all the other things. So in upcoming video today, I'm going to tell you one by one comparison that why and in which cases I am totally biased toward fat dissolving injections, and in which cases we are going to consider other modalities and other cocktails of treatments in the patients. Obviously there is polycystic ovaries, hirsutism, endocrine problems, growth factor. In men you have a lot of other issues where testosterone is deranged. There are stress as a factor. There are a lot of diseases, thyroid, diabetes, blood pressure, uric acid. Patients are undergoing in fatty liver, kidney disorders, heart diseases, and there are so many diseases which are like SLE, MS, rheumatoid arthritis, and there is a long disease of immunocompromised patients and backbone patients and knee joint patients and cervical bone patients who present with us with this particular complaint that they cannot operate and they cannot do exercise at their own. So this is a very important topic these days, and I think we need to talk more and more about it, and patients and clients need more and more awareness about that which modality is good for which kind of client. I hope this video is beneficial for any of the clients, and see you in the next video. If you want to have some particular topics in your mind and you want us to make some videos about that, please mention all those subjects and topics in the comment section. Thank you very much.